Dr. Anu, can you tell us a little bit about what FPIES is and what is the difference between acute and chronic FPIES?
This is a non-IgE mediated food allergy, so it means there's no evidence of allergic antibody IgE that we test for in classic food allergy. And FPIES comes in two forms. If the food is not eaten on a regular basis or it's avoided and then reintroduced, you can see an acute pattern. So within 2 hours, there's an onset of vomiting. It can be very forceful, up 10-15 episodes. The child is limp. Pale, gray, sort of looking, and 15-20% will really get sick with low blood pressure and will get admitted to the hospital for treatment. But if the food is eaten every day, as usually happens with little babies who are being fed with cow milk or soy-based formulas, you lose this dramatic pattern, and the child has vomiting on and off, not particularly associated with food ingestion. They get diarrhea that is watery and mucousy, sometimes with specks of blood, and the child is not thriving. But then when you eliminate the food and then try it again after several days, you will see this acute pattern.
And how is this typically diagnosed?
Well, diagnosis of FPIES is very difficult because our typical testing that focus on detection of allergic antibodies, IgE, such as prick tests or blood tests, are negative. So you cannot really use that. So it started with the suspicion, clinical suspicion, putting together the fact that the food and the symptoms come together, and then in many cases oral food challenge is necessary.
What can a parent do to ensure that their child is accurately being diagnosed?
I think the parent is the best advocate for their child, so you have to keep going. You have to find a physician who is familiar with this disorder, and I would say mostly allergists would be more familiar with it.
Can you tell us a little bit about how FPIES can be ruled out? Because it seems sometimes that there are other disorders that can mimic FPIES or look very similar to FPIES. So how can that be ruled out effectively?
It may be tricky in the acute setting if this is the first reaction to distinguish FPIES from an infection. But if this happens over and over again in a child who's otherwise afebrile, has no fever, you have to start thinking about it. And many cases, as we mentioned before, you will need to go through an oral food test to challenge to make sure that this is truly FPIES. Otherwise, the diagnosis will be by excluding cardiac conditions, neurologic conditions, or metabolic conditions that can mimic FPIES.
Can you tell us when that's necessary, or when you would normally put an oral food challenge in place to determine if a food is safe or not?
In our center, we don't feel the need or necessity to perform those challenges initially. However, as we follow the children along and we are evaluating them for the resolution of FPIES, then we offer those challenges. And the challenge for FPIES is considered a high-risk procedure and should be performed by a physician and a team that is familiar with this condition and at a location that provides good support for treatment of serious reactions.
As a parent of a child with FPIES, I know that the individualized approach is so incredibly important in terms of the medical and the nutritional management of FPIES. Can you tell us a little bit about that?
This is very important questions. Thank you for bringing this, because it all depends, what foods and how many foods are being avoided. The team approach, it's critical. So you have a
collaborative care is incredibly important for an FPIES child.
If you have a child with multiple food reactions, you really need to involve a nutritionist. You really need to work hard to find a safe food for this child. And the goal is obviously not a regular diet that an other child without food allergy would have, but a diet that is safe and satisfying and meets all of these criteria that we're talking about.
And it can be very scary, and there's a lot of fear sometimes involved with parents. So what's a message that you can give to parents to kind of ease a little bit of that fear?
I think the message is that if you are under competent care by that team that is familiar with this condition, your child is going to be safe. Your child will thrive and will be fine once we have a proper diagnosis.
Can you tell us a little bit about the progression from breast milk? When is breast milk best? When is formula better? And how that relates to FPIES?
Most children with FPIES will tolerate breast milk very well. So this would be definitely the first or preferred feeding, the most natural feeding for a baby. But if a child is symptomatic, if it's having horrible diarrhea or bleeding or is not growing, we have to reevaluate that. And it may be necessary to either eliminate certain foods from mother's diet or move on to a hypoallergenic formula. Most children with FPIES will tolerate hypoallergenic formulas, but there are some, about 10-15% that will have problems with those formulas, will still experience symptoms. So then you have to move on to those really elemental or amino acid-based formulas.
What happens if a child is struggling with the elemental formula? What kind of questions does that raise as a physician, and what would be the next steps?
Well, I think this is such an unusual case scenario that you have to start thinking, is this really FPIES? The first thing would be, maybe try a different amino acid-based formula, because like with any food, there could be some, intolerance. But if the child is still symptomatic on an elemental formula, I think it's really a situation you have to reevaluate. Is this diagnosis correct?
It's such a difficult diagnosis. I could share as a parent, it's so important to have that collaborative care and to be able to work with a physician who is knowledgeable and who can guide you down the right path.
As hard as it is and as difficult, I'm not aware of any fatalities from FPIES, certainly not in our experience, and there are no published reports of any child dying. So, unlike other kinds of food allergies, I think this is
very
reassuring that even though, there could be hard times and, significant reactions, your child eventually will be fine.
One of the questions that I hear all the time through families who reach out to the foundation, and a question that I have myself is, do children outgrow FPIES, and when do they outgrow it? It seems to be different for every child.
This is a condition of childhood, so most children will outgrow their FPIES, and a lot of the time this happens by age 3 years. It will be different for a child who has one food FPIES versus a child who has multiple food FPIES, but the prognosis overall is excellent.
That's very reassuring and wonderful to hear. And I know our foundation's very eager, and we're working very hard to create new pathways for this disease and to bring awareness to it. So what are some of the new and exciting developments on the horizon?
I think we're seeing more children with this condition, and we really need to crack the code of FPIES. And this is not going to happen with the one little center doing some small study. This will happen through multi-center collaborative studies, clinical studies that will tackle this.
Yeah, and I think IAFF is very eager to be able to create those pathways and to create new research, and we're very excited to get a final determination on our application for the ICD-10 code for FPIES. And we would like to thank all the families out there who supported this initiative and all of the physicians who supported it as well. So there's a lot of exciting new developments, and hope, I think, is the most important thing for families to know, that things are changing for the positive. Thank you so much for being here today and for helping us to educate families and patients about FPIES. For more information, you can reach out to us at our website at www.iaffpe.org. You can find helpful handouts and also learn a little bit more about our medical advisory board and our upcoming plans for 2013, which are very exciting. Be sure to reach out to your physician if you have any specific questions regarding your child and their care, and you can always lean on us for support.